What's
Glory.
up? How you
Hey,
been?
moving my offices.
What in the world?
How are you? All right, let's get right into it before you start that. Tell me who you
Blah,
are.
blah, blah.
Let the world know who you are and all the amazing things you've been doing. You had an amazing year last year. So I just want to check up on you, make sure, just see what's going on, what's new for you, and what's the status with everything.
Well, I'm the director of Environmental Health Watch in Cleveland, Ohio, and we work throughout the county. We work on healthy homes and sustainable communities, which entails direct service, research, policy, advocacy, and training. And so we've been really focused on environmental justice. We're an environmental justice organization focused on health equity approaches to make sure we are executing equitable solutions on the ground. And we work with resident leaders and other organizations, hospitals, funders, everybody, right? So under our two programs, Healthy Homes and Sustainable Communities, under Healthy Homes, working with the Lead Safe Cleveland Coalition, which was newly formed in 2019, we passed a law, lead safe mandates, that all landlords would have to provide a certificate to show their home was lead safe to building and housing, and that starts to in 2021. So with that approach is comprehensive. So we created a loan fund to assist homeowners and landlords with the requirement. And I've been selected as the administrator of the Lead Safe Resource Center, which would cover resident, tenant, landlord engagement. It would include education, certificate navigation, compliance assistance, workforce development, and a call center, right?
Mhm.
And then on the loans and grants side, Cleveland Housing Network is administrating the loans and grants. So I've been spending my time building out this resource center, which includes a move, so we can accommodate folks to show up, come to the center, hiring new staff. So we have all these comprehensive components in place, because it's not good enough to pass a law if you're not looking at how we gonna implement it, and
Right.
how we provide supports and funding to accomplish the goal of lead safe housing.
Okay. Tell me, let's get into that a little bit more. Why is this important? Why is this needed? And why was this, let's talk about that.
Well, definitely we have pockets of neighborhoods with children with high lead levels. And the lead level action number, without getting into too much technical, is 5. So if you have a child tested for lead, and let me say, not all our kids are getting tested. If it's 5 or higher, that's a elevated blood lead level.
So can you dig into that a little bit more? So the lead, I'm just thinking is it just paint? Is it just how's the
So
lead
the
affecting the.
sources are paint, deteriorated paint, dust, soil, right? And not so much the water, because of what happened with Flint, right?
Mhm.
People, we definitely need to make sure we're testing water when we can, but our children are being poisoned by crawling on the floor, household dust that gets ground up, lead paint chips get ground up into fine dust. We walk it in, it's on our porches, it's outside our homes in the soil because we had leaded gas, but it generally is in our household dust. You can't see it, which makes it, that much worse, because if you don't see it, you don't think about, I might have lead dust in my home. If your child is not acting out, or you don't see the symptoms, you can't look at somebody and tell they lead poison, but there are symptoms. There are, it's connected to ADHD, it's connected to behavior issues, it's connected to IQ drop, it's connected to low reading scores, dropout rates, is connected to violence. So when we talk about lead poisoning, our children, the people in low income or color communities of color, are mostly impacted, just like with everything else. And it impacts us in the education system, because we talk a lot about education, getting folks into higher test scores and all that. But if their brains are damaged prior to them even getting to school, that's a problem. And we need to start looking at sources and root causes of these things. This is one of the factors that contributes to high dropout rates and stuff like that. And so even a study was done at Case that showed that 25% of our children have been exposed to lead in our CDP in the school system. 25% of our children.
Got you. So the community or people who need help can come to you, and this does what? Do they do a cleanup? They're getting fresh paint. Somebody's painting. Like, what's the? Because I've seen something where somebody was like evicted out of their house because of some lead or something, or they couldn't rent out or something going on like that. Talk about that.
So we're focused on prevention, because even houses built before 1978. More than likely have some lead in it. It's not a hazard until it's deteriorated. We have a maintenance issue. We are not telling folks they got to bake their whole house. And that's part of the narrative, right? It's a lead safe prevention strategy. So if you have a child that has lead poison, an order is placed on the unit. And if the owner, landlord does not complete those repairs, where it's going to be more expensive, because they're going to mandate, the health department is going to mandate that you abate the hazards, meaning that you might have to replace some windows or replace components. And if that landlord does not comply with the order or fix the house, and there's money also from HUD to help. If that's not done, then the people can't stay in the house because a child was poisoned there legally. The health department has to follow that case until that child level drops.
I'm sorry to cut you off. So typically, like what will like say I'm a homeowner or something. So typically, what can I look out for, and typically, what kind of steps can I take, on my own to just make sure that everything is safe at the house?
First, you can do interim controls, right? You can paint, make sure there's no deteriorated paint. You can look in your window wells and seals. You can heap a vac, clean that out, wash the dust up. Dust can be washed up by parents, but there's an environmental clean that really gets to cleaning up the lead dust, which to confirm that the lead dust is not present, we do a clearance. You could cover the soil with mulch, don't have exposed soil, because that could be a potential lead hazards.
Let me ask you this. I'm sorry.
You could cover
I cut people off.
You could cover your porch, with
wait, hold on. How about, I just want to jump into this. You can keep going. Like, we got a lot of houses that's being, we got a lot of fields next to houses. So that's a lot of dirt. And that's not like, I can see like in Shaker, they got grass and all of this stuff, but other areas, it's just, we're getting rid of these abandoned houses, but our cities like Cleveland, East Cleveland, are they doing a good job? But we just got soil next to our house. Kids playing over there because there's no playgrounds. So talk about that.
So like I said, it's a low cost mitigations for this stuff. And that's what we focus, Environmental Health Watch. We work on low cost, no cost mitigation. You can cover it simply with mulch.
I'm talking about a house that was next door to me just got
right.
Demo. You're gonna cover that's a big field. We covering all of that with mulch?
You can. I'm just saying, you trying to ask me what strategies do you do to make sure it's not a risk anymore.
Okay. All right. So I'm just saying, is that an issue? Like these houses getting knocked down, these old houses getting knocked down, and we got these abandoned fields next to other houses that's up?
But you can presume there's lead in it, but until we confirm it with a test, we just presume things have lead in them, right? Okay, gotcha. So just like paint, we can't say automatically it's lead paint. We have to confirm it. As a risk assessor, that's what we do. I'm a licensed lead risk assessor. But if the house is built before 1978, we make presumptions and we work with it as if it's lead.
Gotcha.
So for example, if somebody is knocking a house down, demoing a house, and they don't have a water sprayer, we need to work wet with paint. We can't dry scrape. We can't sandblast without the attachments, right? Because then we're just blasting lead paint all over the place. So if you see somebody knocking down a structure and they don't have a hose, that's a violation. You need to call building and housing.
Okay. So that's what the hose is for. Got you. So I know you was doing some other stuff too. You're doing all kind of stuff. Talk about it.
So yeah, so that's on the Healthy Home side. The Resource Center be up and running this summer. And then the Sustainable Communities is an approach. I started about 2009 working in communities of color around sustainability. What does it mean to them? How they define sustainability in their communities and develop solutions. So from that plan that was developed by communities in Buckeye, Mount Pleasant, Woodland Central, Kinsman, in Fairfax, we have had a roadmap for the last 10 years around what people might want to see in their communities, creating environmental stewards, youth leaders, adult leaders, also installing gardens, working with RIDAL, working with other partners, community development corporations, to then teach cooking classes, vegan, vegetarian cooking classes, right? Reducing meat, which impacts climate, which also impacts our health, and think about healthy lifestyle approaches, but also led by residents, led by community. We don't go into neighborhoods telling people what they should do. We go in and ask what they want to do, and then we try to support it. So with that, we have evolved to work on national grants also. And so we worked with Kresge over the last 3 years in partners in Kinsman Central, focus in Kinsman Central on food, arts, and culture. So we have a youth leadership program, which you participated in, thank you very much, and had all kind of entrepreneurship components to it, because we know children, youth understand their communities. They have ideas, they have solutions, and we don't have to wait for them to be 18 to be leaders. Let's give them the information and see what they do with it, as well as adults in their communities. Food deserts is not an appropriate term anymore. We talk about food apartheid, which my partners, national partners, told us is apartheid. There's things going on in the neighborhoods. We need to find those people, elevate them, and then work with them and partner. So we had food, arts, and culture. We had the Fresh Fest last year, which thanks you participating as well. And at the Urban Farm and Park, where we brought national artists, local artists, visual artists, entrepreneurs into the community, and made sure we could have a good time. We could elevate culture and arts in the neighborhoods. We don't have to go somewhere else. We don't have to go downtown to party, have a good time, and have national artists support us. So we did that as an example of a culmination of the work. The youth have created juice products that they'll are selling, and we'll work more this summer, just focus on that product social enterprise. We have open mic at WOVU once a month, led by Walter Patton, who's super cold in this community. And we have youth that have their own radio show on WOVU. So we kind of building those bridges between the program to the community leading. And we're in transition now. We also have a Healthy Food Finance Initiative, food cooperative planning, feasibility study going on with resident leads at the table, with the academics, with the funders, and with other nonprofits. And we want to balance those tables. There's a pre-development phase, because a lot of times residents get a checkbox approach, or somebody come in after they created the plan and say, hey, you like this? Okay. Versus the residents being at the table from the development of an idea. So it's a feasibility phase, because we need to understand the type of grocery store cooperative that we might be thinking of. Is it feasible for that neighborhood? Is it a smart business decision first, not based on emotions? I mean, we understand that there's not a good lot of full service grocery stores in Central Kinsman with Dave's Clothes and stuff like that. But what I don't want to do is set people up for failure, make promises, but we should own something, right? So now I'm learning more about economic justice, right? It's like, we can talk about environment, but if people don't have money, that's what I've been really focused on, is entrepreneurship. Like, how do we take the dollars that we've been awarded, granted, and flip that and create income? So I'm really interested in ownership, land trust, cooperatives. You know, how do we do that in a real way that's gonna benefit folks? So we gonna keep working on that and then see what happens.
That's amazing. Thank you. I mean, that's dope. Talk about the shift now, with the COVID and all of that stuff. And I know that's changed the landscape a lot, with a lot of stuff that you've been doing. So talk about kind of the changes and what you're seeing towards that and, all that type of stuff.
Well, with the resident leaders from the Healthy Food Finance Initiative, they decided they needed to support their community. So I have allocated and got some dollars from Cleveland Foundation to support them. They're doing delivery services in partnership with Garden Valley Neighborhood House and Little Africa Food Co-op. They created their own initiative called Feed the Soul, with free thinkers and true media creative. I'm sorry, Alicia Corpening. I got her the company name all messed up. But they banded together and started the work before I even got any money, because we was like, okay, let's figure out how to support you. And so we're still doing monthly meetings with the Healthy Food Finance team. But in the meantime, we also shifted to support them, and also Fred Ward in Glenville. He works with me on the Healthy Home side with the Resource Center and the lead work. So we're going to support Glenville with Fred Ward Numu Foundation as well. So that's a major shift. And we have our staff, Christina Keegan, who created the recovery website with other partners. So she's spending her time doing that, right? Mm-hmm. And so some of the stuff we put on a back burner, like a pilot for a Healthy Homes assessment service, which was a fee-for-service program, but we put that kind of on the back burner because it was a home visit strategy to do assessments for folks. And then the Resource Center, I'm hiring people virtually, which is what they're moving, like we still doing what we do, right? So that's just the workforce. I wasn't gonna start that till later this year anyway. So we're starting to think about ways that we can continue to do training and onboarding with new staff, but definitely the move has gone a lot smoother, even through this process. Our contract work that we bring people in to do education for the Lead Safe Cuyahoga, Lead Safe Cleveland programs is kind of on hold. We're gonna try to do that virtually, I guess. So a few things, some Lead Safe Living Now series we had planned for Clark Fulton, couldn't do that, but we did one in Glenville in the fall. So that's making those shifts. So
got you. Can you talk about some challenges you see? How do you feel about Fresh Fest coming up with the social distancing and stuff?
I had to cancel. So I just secured a national artist. We were working on getting some corporate sponsors. So they kind of had us kind of on hold. We had submitted a lot of proposals and stuff. So I decided I'm either going to do it right or not do it at all. I don't want a half-ass festival. Right. I don't want a festival and then we can only have 500 people all the time, work money. Right. So we will move it to 2021 and work on securing more money and try to make it bigger. Maybe have two national artists. So that's the only, I had to really make that decision because there's so many moving pieces and parts, and then they're talking about it might be another uptick in the fall, and like it's just too many unknowns, and it takes so much time and money to raise funds to implement something like that. And that I wouldn't want people to come or be uncomfortable or not come because they're uncomfortable. Right. So I think it was the better decision. What we will do is probably have some smaller events leading up to 2021, right? Okay. Not to keep things fresh. So right now, MOCA has agreed to show our documentary Bridging the Gap in July. So we need to talk with MOCA. That'll be like our first event to talk about the festival, also the Fresh Flow program, all the work we did over 2 years.
Can you talk about Fresh Flow and all that stuff too?
Yeah, Fresh Flow was really focused on we had a planning year, then we had a 2-year implementation. In the planning year, it was first time Kresge merged their health and arts program. So we were one of 23, 26 cities to get this national opportunity. And we partnered with Fresh by Nature Records, Riddle, and Garden Valley Neighborhood House initially, because we knew children were kind of at home and people were at home making music. They didn't understand the business side of music. Hip hop was started in public housing with a party and an idea that's now global. So we decided on our engagement strategy to be around youth, leadership, and hip hop, and business and entrepreneurship, along with healthy lifestyles. The kids cooked. They had cooking classes. They also went on a farm and learned technical skills around growing food. So we had all of those elements in our plan because residents said that kids needed something to do. That's all we knew, right, from our survey. So we implemented that. And the culmination was the first year culmination was to how we had all of these sites that we activated across the Kinsman, across Central, start from Garden Valley Neighborhood House to the farm with the kitchen at Cornucopia, all that, right? Which was crazy. We had green space. We had DJs outside. We had visual arts, graffiti going on. It was a lot of work, but it was cool, but it was a lot. Right. So then we took that and just tried to pilot with this arts and culture approach, work in this community where people respond to it, where they come out, and we showcased the youth that first year. We showcased the youth. We had basketball tournaments at Antoine Gardena. So the first year we kind of threw it out there. The planning year we had some pop-up parties in green spaces that worked. In the second year we had to showcase. The third year was the festival to kind of still bring those health healing modalities into space, yoga, sound healing, you know, and it was for us, by us, but it was inclusive, meaning that anybody from across the state could come. But we was clear that these were Black artists and these were Black entrepreneurs, and entrepreneurs from the neighborhood needed a space to set up, right? Without charging them a lot of money to come in and sell. I didn't have social services there because that space could be used for an entrepreneur. And so we wanted, at this scale, we wanted to have a festival at scale where people could make money and not pay a lot, right? So people weren't ready for that. They was thinking this is a little community event. No, we had about 6,000 people show up. So they sold out. So that was good. But yeah, we want to continue to cultivate entrepreneurship and artists in our communities and bring people together and use that as a platform, and also have other programming throughout the year where it makes sense. As long as people are responding, we'll continue to support.
Nice. So since you're on the ground with the people, is anybody calling you? You got any words of advice or anything like that? Are you seeing any issues going on now, or any people that's like reaching out to you, need some answers about something, or, you know, any support you've been given?
Yeah, well, I think that I really build relationships, right? So with the residents and the leaders that I've been doing this with, neighborhood leadership for environmental health is what I started with, and I'm still in contact with a lot of those residents today, you know what I'm saying? Or they built their capacity through working with me, the classes or environmental health watch or things we've provided over the years. And some of them are at decision-making tables now. So that's what's important to me. Being there, being open, building relationships, and not just showing up for a particular project, right? Projects are great for engagement, but what's the policy attached to it? And some people ready for that and some ain't, but the ones that's ready, we're taking them through policy and advocacy classes, because what's going on with me and what I've always seen is that residents are disconnected from the decision making and understanding who's making decisions, who's responsible for what. So there's this anger sometimes, or just frustration about what they know is going on, something ain't right, but then they don't know the role to take or the strategy to create to get what you need done. It's not about just being angry, it's what do you do next? So I think that with all of the questions and issues that people focus on the issue versus the broader strategy, the decision making, it don't matter what issue you're dealing with, you can figure out a way to get to a solution because you know the pathway to advocate for yourself.
Right.
And then money attached to what you want to do in your communities and you leading that. Then we need to think bigger and broader about policy, advocacy, decision making, and take that in and build our capacity to then elevate and execute something versus just talking about what somebody ain't doing for us. Like I think you told the kids, ain't nobody coming to say.
Right. So it's a lot of education that needs to be, it's a lot of education that is very needed. And can you just touch real quickly on like the technical aspect? Because I think a lot of that evolves around technology too. So, getting these classes, getting these courses, knowing what's going on. And, I kind of talk about the digital divide a lot. A lot of people don't have internet, or they do have it, or they just got one computer. So they may not be getting the education that's needed for what we're talking about.
So I want to flip back to this Healthy Homes piece in a resource center. One thing we did do through the work of the Build Health Initiative, bold, upstream, integrated, local, and data-driven approach, which was another national project. Cleveland was selected and actually was one of the top cities with our integration at the city level. We do have an app called housing.health that you can log on, look up an address, see if it got violations, see if the landlord is registered, right? There's a mandatory registration that we push to get enforced and a proactive inspection. So thinking about root causes and getting the systems together so the vulnerable people don't have to negotiate and navigate all of that, because we got a system. Technology, we started with data and technology to think about what impact we could make through a phone. You got an app now. We got a web-based app that anybody could use across the city. We know that a lot of that development came from asking resident tenants what they needed. And so apparently a lot of people got cell phones, right?
Right.
So we can't solve for everything, and we know that's an issue for some folks. So we want to work with social service agencies to kind of get the app in their hands if they're helping people, or the resident leaders that are working under the resource center, they'll have that tool to help residents. So I think what we need, and the resource center is giving me an opportunity to create this infrastructure with resident leaders at the core, organizers at the core across the city, not just say, go to this website, but also have people in communities helping and talking about it, bridging those gaps. And then the people that don't have access, they can come to the resource center. It's centrally located. I have workstations up. So we'll have to figure out, in every neighborhood is different, in every community is different, but we got to continue to have this continuous engagement across the city. So I'm trying something new, and I tell the residents, look, I'm trying something new, whatever, we'll see how it goes. Yeah. But my organizers, I have 9, which is the core to that resource center, along with staff, and their role is to continue to build relationships and bridge those and hear from residents regularly, so that all that information can funnel to the top so we can make different decisions at the steering committee level, which is representative of everybody. And so we can make adjustments. So some of the issues is that we can't stay stagnant, and when we think we came up with a solution, unless it's iterative and you hear from people, understanding if it's working, if it's not working, you ready to make adjustments, you have to have some fluidity in regards to getting a systems change too, and solutions, and understanding that you got to have everybody participating in the way they can. So that means we do voicemail, we do face-to-face, we do technology, having all of those tools and making sure we have a understanding who does what, and people don't feel like everybody pulling on them, because the people that's impacted live in the same houses, in the same communities. So our organizations need to be more coordinated, so we're not just pulling at the same folks with all these different things, and also giving them a space to explain us what they need. So I think, I always talk too much, whatever. I don't even.
No, you good. You good.
But go to housing.health to look up the status of your unit. That's important because a lot of people move into units and don't know if they got violations, if it's about to be foreclosed on, and we can try to help that the best way we can.
Nice. Tell me about where'd you get all this leadership DNA and all this energy and all this?
I'm a Aries. No, I don't know. Shoot, I'm just always learning. And
I mean, from what? You was always like this? Like, just go back a little bit. You was always like interested in helping the community, and you just.
I wanted to be a physician. I went to Case to be a doctor, and I went for social. So Lord, I don't even know my major. Sociology was my major.
Really?
What I wanted to do was help single mothers like myself, because I wanted to show that even though you had kids early or young, you could still reach your goal. So I guess it really was about me being goal oriented, but initially I wasn't. I went to high school. I went to Heights. Heights, how are you?
Did you?
Yeah.
I went to Heights for a minute. I went to Shaw.
Oh, so I went to Heights. And then I had 2 kids before I was 21. So I was on Kinsman. I was living on Kinsman, right? And it was like I was just working regular jobs and then I noticed, this was funny, I noticed women coming in that could buy shoes on their lunch hour. I was pregnant. I was pregnant with my second child. And I was like, I want to be able to buy shoes. Literally, that's what shifted me to like, I guess I need to go to school.
So did you know somebody that was going to school already, or you just was like, you just went down and?
Because when I was in high school, I was running around hanging out with people, cutting school. I wasn't like no straight A student or nothing.
Right. Me neither.
Went to hair school, like, I could get out of school if I go to hair school. Went there, I was cutting up with my crazy friends. So then when I said my mother was a nurse, and I was like, okay, well, I'll go be a nurse. I was like, Mom, gonna start going to school. And then what happened, I was like, why should I be a nurse if the nurses know more, just as much as the doctors? I might as well be an actual doctor. And then I said, well, I think I want to be on Oprah, and I'm going to tell people I will get this house with single parents. They can work together. It was all about helping other mothers attain their goals for me. And then when I got to Environmental Health Watch, it's interesting, when I started doing home visits, I started running into a bunch of single parents that didn't know what was wrong with their kids. And then they had mamas that was like, oh yeah, you had lead poison too. So we had 3 generations of families living in housing that had poisoned their children. And then in St. Clair Superior, over 60% of the children have been lead poisoned. That's when the level was at 10 or higher. So then I'm tutoring kids while I'm in college. So I applied to Case. Like, I'm gonna be a doctor. I applied to Case, didn't apply nowhere else. My section net came through. And I just was like, okay. And I was year round. I was at Tri-C for 2 years, working at daycare at 6 in the morning, going to school to 10 o'clock. And I like didn't stop. I just went to school. And then I got into Case. And then I got my voucher like that same within the next few months. Like, it was God really helping me get to my next, where I was going. So then I was able to move, go to school, do work study, raise my kids. Because I didn't want to continue to work and go to school and then see my kids to 10 o'clock. But I was able to take them to work with me because I was working in childcare. I became a manager then. And that's when I started to have this kind of leadership role. Because the director promoted me, which everybody hated on me then. I had to get through that. Because I was your girl yesterday. Now you mad at me? Because I'm your manager? So I guess that was my first leadership role, I think,
Mm.
doing that. And then as I worked at EHW, I started a national project and met all these activists across the country working on lead. And that's what really shifted my approach, my thinking, because I was excited. I was impressed by all of them and how they thought. They was really high energy. I'm like, dang, who are these
Well,
people?
can you name somebody that you look up to, or anything that you're reading and anything like that? Like you kind of touched on it a little bit.
Who I look up to now?
Yeah, like anybody that's like really inspiring you right now, and like maybe you reading their books or you really absorbing a lot of their content.
Well, one lady, Elizabeth Yamp here in Brooklyn, she runs Uprose, and I did a race, food, and justice conferences for 5 years with Riddall and Case. She was one of my presenters, and she works on climate change, but she has a youth core, and one of her youth was one of my presenters as well for race, food, and justice. And I mean, she is a very powerful person. She's go hard for climate justice. She went to Paris. She started the climate march in New York, made sure people of color was there in the front. I mean, she's really, really cool. And I'm like, do you know Elizabeth? You know, some people know her and some people don't, but she is very powerful. So I always kind of watch her because she was the one who really made me think more about how are we building the next generation of leaders. And her leaders are cool, like her youth. They, they know they stuff. One of them won an award. That's why I brought him in as a main speaker. I have Allison Carpenter. She's one of my friends. She's my friend's daughter, but she was the youngest politician in DC when she was going to Howard.
Okay.
And she's cool. She was one of my presenters at the last Race, Food, and Justice. And she know Michelle Obama, like Michelle Obama's fangirling on her. Huh?
What's her name?
Allison Carpenter.
I talked to her.
Allison cold-blooded.
Yeah.
Okay?
Yeah.
She don't play either. So she helped with the whole East Cleveland ride thing. And she, so I really. Huh?
She reached out to me because she saw us doing some stuff from East Cleveland. So.
I sent her your link.
Oh, you did?
Yeah.
So that's what's up. So what do you need from us?
Shoot some damn support when the haters out there hating. You be like, nah, dude. Kim ain't like that.
Yeah. Still?
Always when you rising up,
Oh my goodness.
Nah, I'm just being silly. Storytelling is my weakest area. And I reached out to you because that's what you do. Right. And capture stories in a way, and then the way you edit stuff. So I still need that because I think we need to really figure out how we are capturing our stories and from the perspective of the people that need to be heard. So that's bridging the gap. I'm excited about that. I need your promotion. You an influencer. I need you to need you to promote my and so the next thing is hopefully we can get bridging the gap because we edited it, we added it, we had a sound engineer updated. So bridging the gap is Walter Patton's. He directed it, we produced it together. And so hopefully with Mocha, we can launch it in a
When is it launching it?
Hopefully July 18th.
Okay.
And we're trying to figure out ways to do it. I suggest we do it outside or something. I don't know, but that'll be great. And then as I do the resource center work, the voices on the ground, the resident leaders, the organizers, maybe figuring out how to capture their stories or the way, why they involved, what does it mean to them? And then capturing that perspective. I stayed out of bridging the gap. I didn't get interviewed because we got to stop. The organizations got to stop speaking for everybody, right? Right? And really make more space for residents to speak for themselves or tell the story the way they want to tell it, right? So that's what I'm really interested in because I'm bad at it. And nobody know all the stuff we do because I don't know how to. I don't know
I
how to
know
do
you do a
social
lot. You
media.
do a lot. You do a lot. That's why I was just trying to get you on this platform so you can share some of that stuff. How can we find you?
You can go to ehw.org. That's my website for Environmental Health Watch. We will have leadsafe.cle.org. It's a landing page right now. That'll be a full website for the resource center. We're on Instagram. One Garden Valley was our initiative. That's the Instagram page. We're not real active on it right now. You can find us on Twitter, on Facebook. EHW is on Facebook. That's where I promote, put a lot of information up, what we're doing. I try to keep that updated, the Facebook page. And then when the resource center open, you come see me.
For sure, for sure. Thank you. I appreciate you. Thank you for taking the time to hang out with me. I'm mad at you. You ain't calling, check on me, make sure I was all straight or what?
I've been watching your videos. I know you all up on social media doing all kind of interviews, all in the video.
I'm like, let me call my girl and see what's going on.
Man, just moving. But come see the office.
Where the office at?
4600. Oh, the new resource center is going to be 4600 Euclid. We haven't launched it yet, so don't say nothing. But
Okay.
4600 Euclid, we have 2 suites there. And then across the street, we have a workforce development workspace. So we're going to have a hands-on workforce development program, short program, right? To make sure that people can get in a pipeline to do the work for the lead safe compliance and for landlords and homeowners. So.
Oh, I got you. So no other I'm gonna end the, I'm gonna stop the recording, so it's just between me and you. So
Okay.
everything else been good with you?
Yeah, just it's still recording.
I know. I understand.